By increasing libido, it would mean things like, for women, if there's vaginal dryness, that can greatly improve to a point where there's no more vaginal dryness. If there's pain or difficulty and just discomfort in having sexual intercourse, that goes away, where it becomes more pleasurable to the woman instead of having to reach for a lubricant, or if it just feels like it's just not a comfortable sensation having sexual intercourse, that can go away. For a man, what it can mean is that it's easier to be aroused, where, you know, sometimes as men grow older and they work harder and life just gets consuming and they find themselves not as aroused. And it's difficult to talk about, especially with a female practitioner, but usually when men do bring it up to me, it's usually because it's someone's husband or a friend or someone who's known me for a while, and they realize that I'm pretty harmless. I'm not going to judge them, and it is kept behind closed doors. I won't tell people what exactly I'm treating them for. And the gentleman might say, you know, basically he doesn't get aroused as quickly when he's with his wife, or it's harder to maintain an erection, or, you know, it's premature ejaculation. They're all, you know, different forms of erectile dysfunction. And so increasing one's libido, especially if it's a gentleman, it can be where he's easily aroused, like when he was 17 years old, and it's controllable. It's not something that's going to last for 4 hours, and you know, it's a pleasurable experience again. But especially for women, I can understand a woman's perspective when she says, you know what, I come home from work, you know, I got to tend to the kids, and then I got to help with homework, and then I got to make dinner, and it's already, whatever, 8 or 9 o'clock, and she just wants to go to bed, and there's no desire. And her husband might be, you know, just wanting to be intimate, but it's very hard for the woman to want to have that intimacy with her husband. So by strengthening the woman's libido, it may not happen from the first session, from the first acupuncture session, but it will happen. I will say one of my most recent cases is a woman. We'll call her I. So I emailed me after her first treatment, and she said that her fluids, her vaginal fluids, were just much more profound, much more pronounced, and they hadn't been like that for years. And if one session of acupuncture can definitely do that, because she didn't do anything else. And I said it definitely can. I usually ask women to give it anywhere between 6 to 20 treatments. That's my standard case for most things, because I don't know if they bounce back really fast. I don't know what their health is like. Some women require 1 or 2 Chinese herbal formulas to help them with the gynecological process, because there are usually menstrual issues combined when there, for example, is vaginal dryness involved. So it's, you know, it's a lot of fun when I get to talk to a woman about something so important, but it's so embarrassing to talk about with our friends or our family, not having to take medication to, you know, to treat especially vaginal dryness or sexual discomfort, and they don't want to take medication for it. They just want it to come naturally. And when you do acupuncture, and you do it for anywhere from 1 to 10 to 20 treatments, and you see a profound change in your cervical fluid, in, you know, having sexual intercourse and just menstrual changes, it starts getting fun again. Just life starts getting fun. And that's part of my work, is making the lifestyle much more fun for patients, especially when it comes to libido. So I hope to help many of you out there, especially during St. Valentine's month. And if you would like, feel free to give me an email at anna@moveyourchi.com, and I'll send you some specials. Thanks, and take care. God bless. Okay. Okay, say it over there. Go.
You do
Hey, my baby.
My name is Angeline. My mommy can get you pregnant.
Yeah.
With acupuncture.
Thank you.